Hi, everybody. Hey, I'm so happy to see so many of you today. Good morning. Oh, let me take off my mask. Okay, good. Hey, I really appreciate my Hawaii friends so early join me, and also my Los Angeles friend, and also my Canadian friends, and also my Philippine friends and Hong Kong friends. I appreciate you actually so early joining the meeting and being so on time. Let me share with you why I want to talk about this, because the fact is that I found that a lot of people, last time I talked about, well, you can't stay the same old to basically same old to manage the diabetes. And as you know, diabetic is a lifelong disease. You have to continue to move on and to change, right? And so some people came back after my lecture and said, well, how do you identify my complication? So I put this lecture just for these people to continue answering. Well, yes, you have to look at yourself, not to be just believe, wow, I can always same old. It doesn't work because of that. Diabetes is a lifelong disease. You got to go with, continuous managing and so forth. So you really cannot do that and then go from there. So that's why this lecture will be kind of important for everybody to kind of better understand, well, how I'm going to maintain and understand, do I get diabetic complication or I don't get diabetic complication? So this is what this lecture about, and I think this will be a very good baseline to get you better understanding and hope that will clarify a lot of myths for you guys. 嗨，各位堂友，係 Andrew Lau 老師啲 President 你好。嗱，今日好多謝好多堂友咧，今日亦都有機會嚟聽我哋講下書啦。咁今日有啲香港朋友啦，有加拿大朋友啊、美國朋友啊，亦都有菲律賓朋友，好多不同嘅人士。但係其實上一次我哋講咧就係話，如果你係糖尿患病者，你唔可以永遠都係一樣咁嘅 treatment 啊，唔得嘅。你要繼續係去努力去知道要做啲乜嘢。咁所以變咗嚟講咧，呢、個webinar 咧就係 answer 到一啲堂友，哇！咁如果係咁講，我點能夠繼續會係更加多方法睇到係咪有糖尿病嘅併發症啊？點解更加差啊？咁呢個係我哋今日嘅重要嘅題目。Okay, so today I think the lecture will be the webinar will be really good to help you guys to understand what it is. So I'm going to share my screen right now. Okay, so the question here is, how do you identify diabetic complications? And that's the topic today. 今日我哋講嘅 topic 咧就我點樣去認識咩叫個糖尿病嘅併發症啊？我點知我只係差咧？咁呢樣嘢咧係好重要喎，因為你唔知你差嘅時候，你繼續都係同樣嘅東西，你咪好弊，係咪？So everybody should able to see it on the screen, and I think thanks Eugene to answer that, Tommy. See that? Okay. So let me take me 1 minute. Sorry, 5 minutes. Just go through real quick because I have a lot of new people coming in. I have about almost 10 new people comes in. So I need to tell them really understand what is the basic of diabetes. Now, diabetic, don't forget, is a chronic disease. Is part of full life. You don't get well, so don't pretend that, oh wow, maybe I drink LOWSUTEA medication, I'll get well. You won't get well. You will be always stay the same. So keep that in mind. And only thing you can control. Okay, you will be, once you become a diabetic, you always become a diabetic. The way how you control, you have to control your blood sugar, because the reason why most important is the blood sugar will affect your entire body, because the blood and the cholesterol mix together, your blood becomes thick and it forms plaques everywhere for your brain, heart, everywhere. So that is why that's the most detrimental damages for your entire body. So you need to control blood sugar. So make sure that the A1C, later on I explain what is A1C, lower than 6.4, not 7, at 6.4 and below. At best, you can get it to 5.7. And pre-diabetic patient is the same, no different. And on top of that, you cannot eat any white food, meaning your rice, your bread, you cannot drink soda and juice, because all these are sugar. When you eliminate that, you will get very, very good. And then you can certainly drink LOWSUTEA. I'll give you some more stories, some of the people that have been using LOWSUTEA, how been helpful for them to lower the blood sugar and maintain always good level. And so your diet change, lifestyle change, meaning you have to exercise, you have to control your weight, you have to take low-carb diet, you have to drink LOWSUTEA, you have to measure your blood, in order to understand. So this is what you got to do.嗱，各位堂友記住，糖尿病永遠唔好嘅。如果你有糖尿病咧，你只能夠控制，成世都會一齊嘅。咁變咗嚟講咧，控制點解？因為如果唔係咧，糖尿病嗰啲糖咧，同你嗰啲血撈埋之後咧就好 thick， 所以全身嘅血管咧都會塞嘅。咁嗱，我講講點解係會咁啦。因為第一站嘅糖尿病嘅人咧，就係會啲血佢個 cholesterol goes up， 即係佢膽固醇高 up， 咁佢就damage 嗰啲 B cells。B cell damage 咗之後咧，咁佢咧就會變咗咧，就將糖同埋B 一齊做埋一齊咧，就會好結，好結之後咧就會變咗咧，就令到啲血管全部開始慢慢塞。當佢塞嘅時候咧，血壓會高 up OK， 咁咧血壓高 up 嘅時候咧，咁咧第二個 stage 喎，咁全身都係向 form 好多 plaque 嘅喎，咁然後第三個 stage 咧，你糖開始一路高 up 啦，啲糖高 up 嘅時候咧。你個 A1C 咧就由5.7去6.4，一過咗6.4咧已經糖尿患病啫。咁呢個4個 stage 咧成日都係咁嘅 ，OK？ 所以每一個糖友都會 go through 個4個 stage。Now remember, we'll talk about very important to control your LDL first because your cholesterol goes up. The next thing, it will damage your B cell. It doesn't take sugar into the cells anymore. Then the sugar will continue to goes up. Now sugar and cholesterol mixed together, what's going to happen is your blood becomes thick. When blood becomes thick, you know what? You will get formed plaques everywhere. And that is long term. That's the most damaging to your body. And then the third stage will come on, your sugar continue goes up, your A1C is going to start going up. It will go from 5.7 all the way 6.4. The fourth stage, when you're over 6.4, guess what? You are diabetic. And so everybody goes through this stage. And that's why you need to watch. Make sure that your blood sugar are well controlled. Now, why people are drinking LOWSUTEA? The reason why LOWSUTEA is one, the guava leaves actually it does is it delayed the absorption of sugar into gut vessels. So net neurosis is almost like blocking the sugar into the vessel. Then the less sugar go in there. The rest of them that it doesn't go in, they excrete through the fecal matter. And then beta malin, there are two things. One, increase the sensitivity of the insulin, so you get more sugar into the cells, even though you have insulin resistance, but you increase sensitivity, you get sugar in the cell. Secondly, it has a special function as carrier. It gets the sugar, cholesterol, and salt. It dumped out to the urine, and net result, you have what? Less sugar, less cholesterol, less salt, and detox. Net result, you will become lower blood sugar, lower cholesterol, and lower your blood pressure because lower salt, lower pressure. A lot of people drink LOWSUTEA, the swell also gone down. Now, you don't do anything. What's going to happen is you're going to have all kind of problem that comes on. And that comes on is you have the potential of stroke, cataract, glaucoma, your pancreas not functioning, no longer come out with insulin. You got a risk of heart attack, and that's the biggest problem. Heart attack is the big issue. And then you have nerve damage, and then you have high blood pressure, damaging the blood vessels. And on top of that, if your wound don't get healed, the circulation bad, you will have to amputate your leg. And then you're diabetic, you have diabetic nephropathy. In other words, your kidney will be damaged, and that result you have to end up will be dialysis. And then you have pregnancy, you have gestating diabetic. Down the road, you might be a diabetic. And the worst that you have the sexual dysfunction. In other words, 30% of diabetic patients have no sex. Okay, that is really sad, right? So you don't want it back in this stage. So you gotta able to control your blood sugar to prevent that. 嗱，記住糖友咧，我點解LOWSUTEA會 work 嘅話咧，就係因為咧LOWSUTEA咧係幫助你嗰啲翻手入邊 block 咗啲糖入去血管裏邊。咁你少糖喺裏邊啦，佢如果其他揸糖咧就喺個糞便嗰度掉出嚟。beta malin 有兩樣嘢嘅，第一就將啲糖胰島素咧增加個胰島素嘅 sensitivity，然後咧帶啲糖入去細胞裏邊。仲有一樣嘢好特別咧，佢帶啲糖膽固醇同埋鹽咧喺個尿嗰度掉咗出嚟。咁變咗嚟講咧，糖鹽cholesterol 膽固醇擋出嚟嘅時候咧，咁你血糖、膽固醇同埋血壓都會降低，同埋仲有 detox 掉晒啲廢物走，咁啊好鬼正。但係如果你唔做嘢，繼續係咁生活，繼續有好多糖嘢或者 又唔 exercise，咁弊啦，因為咧呢個咧就你個糖咧有好多不同嘅併發症會出現啦。For example 啦，你會 end up 咧就好多人咧就會 end up 有中風啊，唔記得嘢啊，亦都有好多人咧係會變咗喺嗰個有青光眼啊。最弊咧40至60%有人咧又係心臟病啊、糖尿病者，咁你神經系統嘅損壞啊，咁你 feel 唔到嘢啊，咁你血管又會損壞啊，咁同埋咧有血壓會繼續好高啊，中風啦，咁然後咧如果啲血管唔好嘅話咧，你就會俾人斬咗腳，話好個大劑喎，咁同埋咧仲要洗腎啊，腎壞咗佢，咁仲有30%嘅人咧係冇咗性功能嘅，咁。Now, so in our program, we have 5 programs to help you to lower your blood sugar. Basically, we have drink LOWSUTEA diet, lower your carbs, and then you have also exercise. We teach you how to exercise so you can able to figure out what to do every day to exercise so you can burn up your excess sugar and also increase your insulin sensitivity. We also lower your weight so you don't continue to have high weight. So your BMI has to go down to 23 and lower. Every week we have some webinar to show you, to give you some additional information, so you always have the plan. So you might say, oh, I heard this before, but you might forget. So we continue to encourage you throughout your life. Imagine that, throughout your life, figure out how to do it and give you all the new knowledge so you can able to become healthy. So we want to drive your A1C all the way down to about 5.7 from whatever level you are at. A lot of our people right now drinking LOWSUTEA, their blood sugar level is about 10, 11, 12, and we were able to drive them down all the way really nice up to 5.7. We have quite a few individuals now is already 5.7, so they're very happy. But they do work. They try themselves, really work. They monitor themselves. They take the blood sugar. They take the diet control and so forth to get it there. So that takes effort. 嗱，各位同學，其實我哋咧公司咧仲有5個 program 係 proven program。第一，我有 low carb diet 啦，即係低碳水化食物俾你啦。飲去糖茶點飲咧，去降低血糖啦。仲有點去做運動啦，能夠令到你個糖降低啦，同埋令到你個sensitivity 你個呢個胰島素抗拒少啲啦。咁點去減磅啦，同埋咧仲有每個禮拜都有個 webinar 俾你嘅。咁同埋咧。仲有咧就教你點樣去控制血糖咧，就點度血糖啦。咁令到你嘅 A1C 咧，就算你係高係10啊、11、12咧，可以跌到5.7咧，咁你就已經好正。其實你話得唔得啊？好多得，因為我哋而家好多糖友咧已經跌到5.7，有啲係跌到5.2嘅，哇，好勁喎嚇！咁但係佢哋好 take effort 嘅，唔係話就咁企喺度就得㗎啦，佢真係要做嘢嘅。So we have to identify why diabetes have all kind of complications. So you know early, so you can able to actually, when you know early is really good. You know why? Then you can able to identify, go to see doctor, so you don't continue get worse. Okay, so you really, as a type 2 diabetic person, you really have to pay additional attention to your health condition. You have to watch what can cause your, for example, your eye problem, your kidney problem, your feet problem, your heart problem, your memory problem, and entire body part. Later we'll talk more about that, but these are just a few things. One of my professors was telling me, hey, you think that, COVID is bad? Diabetes is worse because it affects your lifetime. COVID is only one season done, but this affects your lifetime. And you will have all kind of, if you don't take care of it, it will get you all kind of problems throughout the life. So early diagnosis is so important to help you check the sign and symptom with early treatment, so you understand what complications under control, and then you can able to give you, more things to kind of watch for, so you can not getting sick. That is our goal. And today we'll give you all these tips on this webinar. 各位同友，嗱，記住咧，2型糖尿患病者咧，好多時間咧都有好多不同問題出現嘅身體嘅狀況出嚟。For example 咧，你嘅腳啦，你眼啦、腎啦、心啦，同埋你個 memory 咧，即係記憶啦，開始差，點算咧？呢個一定要早啲知道咧。咁你要投資咗呢啲嘢落去，知道早啲個 sign symptom 係咩嘅時間咧，咁你可以 get 到 early treatment，咁你就好正啦。 咁變咗嚟講，你最緊要控制到佢，你唔會 get worse。所以我哋好多教授話：喂，你估即係冠狀就會弊啊？依個更加弊啊！糖尿病係一世嘅病，哇！真係弊家伙啦。咁今日咧，我哋 webinar give you all the tips 俾你知道咧，夠點樣控制你糖尿病。So how do I know I have diabetic complication? Okay, now usually diabetic complication is always linked one thing: blood sugar. If your blood sugar is too high, too low, and patient, in order to do that, you have to check every day what is the blood sugar. The minimum you have to check 4 times. If you don't check 4 times, 1 hour, first thing, the first morning you wake up, you have to know where your blood sugar is. Your blood sugar is already very high. After breakfast could be even higher. So 2 hours after breakfast, 2 hours after lunch, 2 hours after dinner. This is at least the minimum 4 times you have to check, because if you don't check, you don't know what's going on. The doctor will also check your what they call HbA1c, and we'll talk a little bit about what is HbA1c, because you got to know, because that is one of the key indicator to do that. And the doctor also, when you go to their office, they also will prick your finger with a fasting blood sugar. Well, if you don't eat, what is that fasting blood sugar again? But if you are fasting blood sugar, you are already 140 or 160, well, you have a problem. Your fasting blood sugar should be under 140 or 120, around that range. If you are over 140, actually you are in fasting, you are really truly maybe a diabetic already. So you really have some of that data. We will talk to you more about that later. So we will teach you what is A1C, okay? So 各位朋友，其實咧你要知道點解你會有呢個糖尿病嘅併發症咧，好重要咧就係第一，你其實每日一定要 measure 你自己嘅血糖嘅。如果你唔 measure 自己血糖咧，你真係會係唔知道係咩問題嘅喎，因為你度唔到嘅，你係冇 sign symptom 嘅。因為糖尿病有個特點咧，初期或到中間你係有啲糖尿病或者開始未到嚴重之前咧，你真係未必有 sign symptom，你只係覺得哇都冇乜嘢啊。所以好多人咧就話我冇乜嘢，點解度血糖咧？但係當你度血糖嘅時候，知道哇原來咧你個血糖係好高嘅。咁但係呢個情況咧，1年後咧你就好多併發症出現㗎啦，所以咧一定要度血糖。咁其實咧度血糖咧，你要最低限都要度4次，第一次朝頭早起身度，然後之後早餐2個鐘頭度，晏晝餐2個鐘頭又度一次，如果第3次、第4次咧，就係晚飯後2個鐘頭度。嗱，如果你係用即係篤手指嚟度啦，咁梗係好啦。如果你冇篤手指咧，其實咧喺香港咧，我哋有呢個叫 Abbott Libby 嘅機器啦，咁你亦都可以度到嘅。其實呢個都到，咁你睇到我依家係6.1，嗱，我依家係食咗早餐後嘅6.1 ，OK。咁其實我都好話成日血糖咧都睇晒個 graph 話俾你聽嘅。So it's so important you can measure yourself picking your finger or you use one of these Abbott Libby. I found many of my clients buying Abbott Libby from me, they can actually get the whole motivation, how they measure, because it's painless. All you do is doing this, measure, voila, 6.1. I have no finger picking. I don't pick my finger. I have no pain. And you know what? I measure 14 to 16 times a day. So I know exactly where I am. If I eat a donut, you know what? I will measure myself. Well, how my donut look like? You know what? And the donut go up to, you know, over 16. 6.1 is about 110 or so. So if I eat my donut, I become 140 or become 8. I don't want to eat donut anymore. Or 9. I don't eat donuts anymore. So that is really giving you a good motivation why you have to measure your finger. Okay. So 度糖係好重要嘅。咁陣間我講多啲咩叫 A1C， 你知道咩？咁其實你去醫生嘅地方，佢一定會叫度糖咧，就篤下手指咧，睇你係完全好啦。Okay, so let's talk a little bit about blood sugar level. As I said earlier, in order to know where you are at, you have to look at where? Your blood sugar level. Now, if you are too low, you are 70 milligram per dil or 3.9 millimole per liter, you are too low. So you need to watch, because that when you're low, you got a handshake, you got fatigue, you have all kind of problem coming in. You have to move your sugar level at least 4 point something about. and many is about 75, 80 and above. That would be good. A good range is over 70 anyway, and not more than 150, okay? And then that's mean 8.3 millimole is the good range already. If you're over that 150, that's actually getting too high. So keep that in mind. Now you can take a picture of this today, and then you can know what's going on. And on top of that, your blood sugar, if you are a normal person, you have no diabetes, you do a fasting blood sugar, your blood sugar should not be over 90 or 99 milligram per dil or 5.5 millimole per liter. Now, 2 hours after you took your food, your blood sugar should not be over 140 milligram per dil and 7.8 millimole per liter. Your A1C should be always less than 5.7. This is when you have no diabetes. Now, if you're diabetic, you all have a little better number, a little high number. Your 80 to 130 milligram per dil is for US. For Hong Kong, 4.7 to 7.2 millimole per liter is when you have fasting blood sugar. If you're pre-diabetic, diabetic, they will use this number on you. But you have over 2 hours after eat, your blood sugar should not over 180 milligram per dil or 10 millimole per liter. And that is the standard for people with diabetes, okay? That means this is that number. If you're diabetic, this is the number you look at. Now, your A1C, by the way, somehow I don't know why I couldn't put this number. This has changed. It's no longer 7.0, it's 6.5, okay? 6.5 is the number nowadays. And on top of that, this 7.0 is a lot of the older folks who based on 7.0 because you know why? Once they're over 7.0, they will start getting medication. But the doctor now rated you, if you are pre-diabetic or you are pre-diabetic 6.4, once you're over 6.5, you are diabetic. If you take 2 times of your A1C over 6.5, you are diabetic for sure. And what they do, market on your record as a diabetic, insurance goes up, everything goes up. Wow, man, that is no good. That's why we try to get people below 6.4 so they don't get the permanent rated as, I'm a diabetes, okay? You could be a pre-diabetic, ever would be good, or lower than to 5.7. I will help a lot of people have been gone down to emission of 5.7. So they are very happy now, but they are continuing to control their diet, exercise, weight, listen to they measure the blood sugar once a week, so they know exactly where they are. 嗱，各位朋友，如果你度血，你一定要知道咧，你本身係咪你低過3.9個 millimole per liter 啊？咁你就係太低嘅，咁你個 range 係應該由呢個4.0啦，至到8.3 millimole per liter 就啱嘅。普通人就應該係5.5個 millimole per liter， 或者2個鐘頭食完飯咧，佢係應該7.8個 millimole per liter。普通人佢個 A1C 係 lower than 5.7嘅，但係你糖尿病患者咧，咁你就多數咧，如果你係fasting咧，係4.4、7.2嘅 millimole per liter 啦，但係你食咗嘢之後咧會10嘅，咁呢個係正常嘅。咁但係如果你係 A1C 度咧，你就應該係6.5以下啦，因為咧。醫生嚟講7咧，你要食藥嘅。呢個就係所有現在嚟講個真嘅新 data 已經係6.5。咁好多醫生就7咧就話哇，你過咗7我就要你食藥啦。所以其實咧，如果一年咧2次度過你係高過7，唔係高過6.5以上咧，咁你就永遠都係糖尿病者㗎啦。咁以後你個 record 咧都係你係 diabetes， 咁啊變咗現所係好貴啲啊嗰啲咁嘅嘢咧，咁就真係唔好啦。咁希望能夠早啲發現，你就可以將呢啲糖咧降低到 under 5.7。So a lot of people ask, they said, well, what did you talk about A1C? What is HbA1c? Why this is so important? 嗱，好多朋友就係點解呢個叫紅血蛋白咧係咁重要嘅咧？咁你咧就一定要知道咧，因為所有全世界嘅人咧。去睇你個係咪糖尿病咧，都係用 A1C 嚟 check。OK， 點解咧？我講真㗎啊。So anyway, A1C is so important because it tell you about 3 months worth of average blood sugar. It's not one day. A lot of people say, "Oh, my blood sugar is so good. You know, I'm always like 120 or lower, and only every time I measure in that time only, on that day, at that one point. It's not average for 3 months. Your blood sugar will sky high during lunch, after lunch? You don't know because you don't have the average blood sugar of the 3 months to tell you. So HbA1c is called glycohemoglobin test, which is testing you with the amount of sugar attached to this hemoglobin, which is all over your body attached, and the hemoglobin will die about 3 months. Amount of sugar attached to this hemoglobin molecule, and then you can always measure by percentage. So if my percentage is actually is 5.7, amount of sugar attached to the hemoglobin is 5.7, then you are pretty much normal person. But you are always a 6.3 or 4, now you are a little in problem because you are pre-diabetic. Over 6.5, you have diabetes. So you got to be controlling yourself, make sure continue to lower down to 6.4 and below. That will be the key objective. 嗱，點解呢個 HbA1c 咁重要咧？因為佢咧唔係好似你每日度糖一日，咁你就只係嗰段時間你嘅糖幾多，你可以成得好高嘅喎。咁變咗唔正仔係咪？我唔可以淨係教一個 point 就話俾你聽，我係 OK 㗎，唔 OK 啊嘛。咁你一定要繼續咧係了解成日嘅血糖點樣，因為 HbA1c 係 measure 你3個月嘅平均血糖。佢呢個紅血球咧，嗰啲糖 attach 俾佢咧係 attach 幾多個 percent 嘅糖 attach 黐住呢個紅血球。如果你紅血球有5.7%，咁你嘅 normal person 啦。但係如果唔係，你係6點幾嘅，咁你已經係 A1C 係應該6.4，已經係前期患病喎。過咗6點幾咧，你糖尿患病者啦。咁呢個係好準確咧地咧睇到你其實本身咧，你係現在你嘅糖尿病去邊度。咁醫生就 base 上呢個咧係 just 你嘅藥啊，都全部喺度做嘅。So they will also check with that to understand your medication how it work with. Okay, now. As you know, hemoglobin is a protein. It carries oxygen all over the body. So net result, you need always to have A1C around. So you always have hemoglobin around, and that's just the amount of sugar attached to it. So that is how they measure the hemoglobin with the relationship with blood sugar. 各位朋友記住啊，佢糖係個紅血球黐住全身。咁佢就全身走㗎啦，咁嗰啲糖黐落去，咁就知道有幾多糖個 percent 糖黐住個紅血球，咁你嘅全身都可以 measure 到喎，幾好啊 ！So the relationship between hemoglobin, blood sugar level, we already talked about this, but more important is this slide, because there is a formula, and you should take a picture in this if you can. Take a picture is very simple. How do I know the percentage of A1C related to my blood sugar? Now, first, you have to know what is the milligram per dil inside here. For example, if I have 154 milligram per dil, this is my average blood sugar on the day, then you have to add 46.7, add together and divide 28.7. Then you will get the A1C. So if you do that, if you add this together, you will get 7% A1C. This is the formula to calculate A1C. So everybody take a picture of this so you can able to understand how to calculate A1C. Now, certainly, if you every day measure blood sugar, you can actually pretty much calculate what is your A1C look like manually. But certainly, if you have Abbott Libby, like this little stuff here, they even calculate for you. So they will not, I'm 6.0 now. So they will give you the average blood sugar and they will tell you the A1C will look like. So you don't have to do any calculation. So Abbott Libby is very good to give you this. So this is what you need to know to do on this information, okay? 嗱，各位朋友，去 calculate A1C 係好簡單嘅，嗱，但係你要 milligram per dil。咁 anyway 查個 chart 咧。我會話俾你咩叫 milligram， 你可以亦都影張相。譬如我依家係154嘅，咁 milligram per dil 咧即係8.6啦，應該係154啦。咁如果8.6咧就加46.7除2.8， 咁咧就會嘅 A1C 係7嘅 ，OK， 咁好簡單，所以呢個係一個好容易咁影張相，各位同學朋友影張相你知噶啦。So if you do not have this chart, I will ask you to also take another picture with this, so you know you have 8.3 minimum to do, you're under 50, so you know how to calculate A1C. So take a picture, everybody, okay? Or you know that just now my blood sugar is 6.1, so I know my milligram per deal is 110. So very easy to tell. So make sure you get this, and this is the conversion factor. So maybe just go take this picture, then it's easy to help you understand the relation to millimole per deal to able to milligram per deal. So very important, you got to continue to look at A1C. Normal person got to be under 5.7. If you're pre-diabetic, you are actually 5.7, 6.4. If you are over, above 6.4, you are 6.5 and above, you are diabetic. And usually, if you are over 7, doctor will get you medication for sure, okay? So this is what you do, and they will check every 3 months, you will see this, okay? So, importantly is why many diabetic and pre-diabetic gotta measure your blood sugar. Because you don't measure your blood sugar, you will never know where you are at in your A1C or your blood sugar condition. 如果你唔度糖，你永遠唔知你糖尿病嘅重要點去邊度。嗱，其實咧喺每一個糖友裏邊咧，佢每次都會用 A1C 嚟度你嘅糖，咁就知道你糖嘅個嚴重性，糖尿病嚴重去到邊度。咁其實咧，如果你譬如已經5.7至6.5咧，其實你已經係去到糖友裏邊咯喎。咁如果你唔繼續做嘢咧，即係如果你5.7、6.4，你咩都唔做，你5.5 3年後你就過5.5、6.5噶啦。呢個係常見嘅問題嘅。咁但係個問題咧好重要，呢個係常見嘅，就係當你係 pre-diabetic 嘅時候咧，你個醫生係唔會俾藥你食，因為你係冇藥食嘅。咁就叫你自己去搞掂佢，要你去俾你能夠可以食藥唔食藥你自己去控制diet啦，去 exercise 啦。咁但係個問題，當你做呢樣嘢嘅時候咧，你好多時咧 ，sorry 好多時咧，當你唔食藥嘅時候咧，你真係唔知做乜，你血糖繼續升上去。所以其實咧好重要咧，真係要了解點降低你血糖，用個 A1C 度啦，同埋度手指咧，兩樣都要需要嘅。OK，very important. When you are pre-diabetic, diabetic, you always have to measure your blood sugar in order to know. Now, as you know, if you got 5.7 to 6.4, you are still a pre-diabetic state. The dangerous part is a lot of people during the pre-diabetic stage, the doctors say, hey, you are pre-diabetic, you got to do something about it. But no one knows what to do. They basically, I'm not eating sweet already, but they still eat rice, they eat bread, they drink juice, they do all kinds of things, and they don't exercise. End up in 3 years, studies show that majority of these people just convert. That's why the diabetic number are shooting up so fast, because our diet, everything are so good nowadays. Everybody, bang, okay, wow, become diabetes. Now, remember, once you converted diabetic, you cannot go back. So the doctor has no medication for you to do that. That's why you have to eat your pre-diabetic, you have to eat low-carb diet, you have to exercise, you have to listen to webinar, measure blood. More important, drink LOWSUTEA, because LOWSUTEA definitely help you lower your blood sugar and you cannot convert. That will be our goal, to help you to actually control your blood sugar. Now, some of the early signs, and you will see this diabetic complication is coming. And basically, your A1C is increased more than 7%. It's going to 8, 9. That's mean you are going to more and more serious diabetic coming. Some of the early sign will come in is, wow, your wound don't heal anymore. You know, it kind of slow down, very slow heal. The reason, especially arm, leg, cut, any healing is very slow. Second most common is you got itchy skin, the skin getting very dry. The worst yet, you start getting growing very itchy, and your vagina getting very itchy, and you get also very fast yeast infection, and it could be all white thing coming out. Wow, there's a lot of yeast infection, very itchy, and also your weight also gain, and your dark skin patch on armpit, growing, neck area. You also got numbness, tingling, hand feeling. So that's when your nerve is start getting damaged. You gotta start decrease your vision, getting blur. And worse, a lot of the people reported is they become impotent. They have no longer sex because the problem is they can feel. Also, they cannot have erection anymore. So the ED is always also very common, 30%, imagine that. So these are the very early warning signs you are approaching a diabetic complication. And your A1C usually about 7% is the kind of things that you're going to start seeing, okay? So I want to first of all alert you folks first, and later on we'll get more tips coming. But this is the early sign. 各位朋友，嗱，最初開始嘅時候有咩糖尿病嘅併發症開始咧？第一你 A1C 一定高咗7個，低高過7%，高過7%， plus 可能8、9 whatever。咁仲有咧，嗰啲傷口壞咗咧，開始唔好咯喎。咁提咧，你成日咧，哇，隻腳又痕，多數腳痕先嘅，因為你腳嗰啲 circulation 唔好咧，嗰啲 skin 就可以 dry 痕。咁仲有咧，好大劑咧，就係開始一個喺個vagina 啊，或者即係個陰道嗰啲地方啦，開始好痕。咁同埋咧，仲有一啲 yeast 嘅 infection 開始好多白色嘅東西走出嚟。咁同埋咧就開始磅數加咗咯喎，咁仲有啲 skin 一笪地方個 neck 嗰度咧黑晒 ，armpit 又黑咗，咁好多地方咧就即係尤其是腳啊同埋你手啊開始有少即係感覺好硬地有 tingling feeling 啊，即係麻痹咁嘅感覺。咁其實咧仲有咧就係眼咧開始蒙啦，咁同埋咧仲有咧好多人咧冇性功能，因為30%。嘅糖尿病好聲，所以呢啲全部係好重要嘅 early sign， 你就嚟有好多不同嘅 complication 嘅嘢，咁你開始注意。So early sign is so important to tell you, wow, I'm coming on some very serious situation with diabetes complication coming. So when your blood sugar are not lower, a lot of time my customer is telling me, I take a lot of medication, but my blood sugar is not lower. I'm dieting very well, but the blood sugar is not low either. Could be because of the fact that your insulin has a lot of resistance. I'll give you one story. This is real. One of my customers, she took her grandchildren to Disney for 1 week, and she forgot to bring her LOWSUTEA. Now she had taken medication. She had been very good in controlling her diet. Basically, she has been taking only salad, a little bit chicken, and then she walked about 7 to 10 miles a day, but her blood sugar gonna come down. She took medication, and she was really worried because the blood sugar went up to 240 as high. So when she came home, right away she took LOWSUTEA. And you know what? After that, the blood sugar continued to go down slowly. The reason is because when you take LOWSUTEA, truly LOWSUTEA help you to, first of all, not blocking the sugar, but delay the absorption of the carbs going to gut vessels. Secondly, you take the sugar, getting more insulin sensitivity, take the sugar into the cells, plus it dump the excess sugar and the cholesterol and the salt out through urine. So then really the sugar will come down. So important. After she died, she said, now I know LOWSUTEA is part of my life continuously throughout the life. So she really appreciated that and no longer take lots of medication, but the blood sugar contain a stable level. Now, certainly we also have 5 programs teach you how to do dieting, weight control, blood tracking, and all these seminars to help you build awareness. So to prevent conversion diabetes or prevent you become a diabetic complication. So these are the kind of things that you have to continue to do as part of life, basically. And we'll hold your hand throughout and we'll go throughout together, do it together, okay? 嗱，好有講個古仔俾你聽，我有個堂友咧帶孫去咗 Disney 玩啦1個禮拜，但係佢唔記得帶咩啊？血糖茶。咁佢咧食嘢咧已經好控制到㗎啦。咁但係咧 exercise 嘅行一日7里咁多喎，但係血糖一樣高嘅。佢高到點啊？去到10幾啊！咁佢其實咧就最後咧翻嚟即刻血糖茶。咁佢就將啲糖咧慢慢降。佢繼續食藥㗎，都唔跌。個原因第一，因為你飲血糖茶咧，你翻食入邊咧係真係當就 block 咗啲糖入去血管裏邊。咁仲有咧個苦瓜咧係增加你胰島素嘅 sensitivity， 帶翻啲糖入去細胞裏邊咧，同埋佢亦都將啲糖同埋cholesterol 同埋啲鹽咧掉咗尿啊掉咗出嚟，咁嘅樣都降低。咁佢翻去咧就以後咧即刻嗰啲糖降低晒之後咧，咁佢嘅話咧真係最後咧就真係呢個LOWSUTEA就係 part of 佢個 daily life 㗎啦。So besides you can see that it's so important to get a blood sugar, understand what it is. There are 2 indicators you have to also continue to look at. Blood pressure. Remember the second level, second stage, your blood pressure goes up. So you really have to check your blood pressure, make sure it does continue goes up. Because if you have high blood sugar continue go up, you know what? You have a chance of heart attack and stroke, right? So your blood pressure should be between 90 to 60 or 120 to 80. Okay, should not. That is just a normal blood sugar, blood pressure. This is what it is. But if your blood pressure is 180 or 110, you need to really seek medical treatment. You have to take, hypertensive drugs to lower the blood pressure. But you don't want to continue go up there because we have people because of their 180, 110, they got stroke. And I have many friends have that, and that is scary. You don't want to do that. So measure blood pressure is your daily chore as a diabetic patient to actually understand what your blood pressure is with, especially when you're elderly. It's so important to do that. Now, your cholesterol also has to be measured. Now, that should be usually measured through your doctor office, whereby your cholesterol should be LDL, especially, should be no more than your LDL should be lower than 2.6 or 100 milligram per dil should be lower than 2.6 millimole per liter or 100 milligram per dil. That's important. But if you have 3.4 and above or 130 milligram per dil, is actually you have higher risk. If you have 4, even higher risk. So you might need medication to lower that cholesterol in order to prevent your possibility of stroke and heart attack. And as you know, more cholesterol you have, one more risk you have is actually the blood become thick with sugar, form plaques everywhere. Imagine that, plaques everywhere. So you really have to prevent that, especially for your heart, because you don't want to get a heart attack. I have a lot of friends now because of the fact that with that, they have to do bypass because of that issue. So triglyceride also become a very important risk that if your triglyceride high, you also have a chance of risk of heart attack, stroke, and also inflammation. So borderline high is 150 to 199 milligram per dil, or 1.8 to 2.2 millimole per liter. So these are the number that you got to focus to know. So that's why I put it up there for you. So you know what is good and what is bad for you. 嗱，各位同學，另一樣嘢你一定要知道咧，就係你血壓高唔高啦，同埋你嘅 cholesterol 高唔高啦。嗱，普通人血壓就90至60比1，或者120至80。高過呢個咧，如果你去到130都 OK， 但係高過130咧，你就要真係注意啦。有啲人如果有180至110咧，你就即刻要睇醫生。個原因咧，太高咧，有機會係 stroke 啊，呢個先大問題啊。stroke 嘅時候咧，你就會即係轉運個腦啦，咁你嘅長手尾就好長㗎啦。咁同埋咧，你 LDL cholesterol 咧要繼續低，要係2.6以下，或者係100個 milligram per dil 啦。咁如果你係過咗2.6啊3.4咧已經好高㗎喎，咁如果4.1係更加高啦，呢個要食藥控制嘅。咁同埋咧，如果你唔控制咧，你個 chance of heart attack 啊同埋 stroke 係好高嘅。同埋多 LDL cholesterol guess what 係會將你全身體加埋糖， 全身體都係將啲 form 啲 plaque 啲撇塊到塊加晒喺糖嚟，咁你就第時咧塞咗，哦弊家伙啦，好多嘢塞嘅時候喺心臟啦、腦啦，依全部係長遠所謂，因為塞咗唔會翻轉頭嘅，最記住啊！咁仲有咧 triglyceride 又係三脂油高三嘅酸甘油脂咧，又係好重要嘅 triglyceride。你個 triglyceride 應該係有1.8至2.2個 millimole 以下，唔好高過佢。如果高過佢咧，又係有呢個心臟病血令到你會有 heart attack 同埋爆血管嘅問題。咁呢啲係全部要控制。So that's the second thing. Blood sugar, blood pressure and cholesterol have to be concerned. Now the next one is always very important for diabetes is a foot examination. Now high blood sugars always increase diabetic neuropathy. In other words, your nerve damage. If you have nerve damage, a lot of time it causes pain or lost feeling. Lost feeling are more common. And then you're going to start seeing sore on your feet. So when you see a doctor, they want to check this area right here, the toe area and the bottom of the feet. That's the most common is right here. And if you get that on the heel, so you really have to know whether you have any kind of blister, don't heal. So that had to watch. The doctor a lot of time will check using a line-on brush on your knee, on your foot to check whether you are feeling, or you use a little picking, finger picking to see you have any small, like a piece of plastic to just poke you and see your feel. Now you can check that yourself also. Use a line brush to check whether you feel it or not. And also you can check with your foot. You have to use your mirror to check your foot because a lot of people cannot able to look at the foot at the bottom. And then you make sure every day you don't have blister or anything like that. So because with that, if you don't heal, you know what? You're going to have gangrene, you lose your feet. And that's not real good, okay? 嗱，各位糖友，如果你血糖高嘅話咧，你個機會有呢個糖尿病嘅神經損壞咧係好高嘅。咁你每日咧就會繼續係睇你嘅腳咧有冇呢個問題咧。最多人咧就係有呢咁嘅呢度開始壞啊，即係開始有blister 啊，有起泡啊，同埋側邊腳踭起泡啦。咁呢啲咧就好重要嘅東西啦。咁嗰陣時你要睇下咧，係你有冇感覺咧？咁你有個膠嘅數腳有冇感覺咧？或者揾支膠嘅東西篤自己有冇諗到有冇感覺咧？呢個要繼續睇嘅。咁同埋有個鏡咧去睇下隻腳有咩問題咧？呢個亦都冇人睇。有啲人咧未必揾腳底係睇唔到啊。咁呢個鏡咧好重要嘅。咁所以變咗嚟講咧，你要每日咧都要睇呢個 examine 隻腳，因為腳如果係有任何嘅損壞咧，唔好咧，你要割咗個腳嘅。嗱 ，another one is very important is eye examination. You have high blood sugar. It damages your retina, the lens, optic nerve, and the viscous gel. And this, only way you can prevent it is by early treatment. Make sure if you don't get your eye doctor check to help you out, you're going to lose your vision. That would be terrible. So the doctor usually dilate the eye, examine your eye, see how's your retina doing, the optic nerve. They'll check the optic nerve over here, the retina here. And if you have a lot of, for example, if you lose total control, you know what? All this, you have blood clotting out. You're going to have a lot of cholesterol. This is all the yellow thing is cholesterol clotting out. Your nerve will continue to come out with all sort of vessels, and that will damage your retina. And so you really have to very quickly see doctor, see what can they help you with your eye. And we did a lecture seminar. We'll do one more sometime maybe May or June to or sometime end of or July to get you know more about eye. So that way you get better understanding how to prevent your eye damage. Because eye damage, once you damage, I'm sorry, you lose your eyesight. It won't work, it won't come back, okay? So a lot of people don't realize that. I want to make sure early warning on this. 嗱，各位糖友，如果你糖好高嘅話咧，咁你嘅眼膜啊、晶片啊，全部咧可以損壞嘅。嗱，呢啲糖咧，如果繼續係做得好差嘅咧，就通道走咧，咁就會好似咧發晒好多不同，好似呢啲 clot 啊、血塊走出嚟啊，有啲cholesterol 走出嚟啊，哇！咁就好弊家伙啦。 咁你要好小心咧 ，make sure 冇呢啲咁嘅 abnormal 嘅 vessel 掉晒出嚟咧。如果唔係咧，一損壞咗，你就睇唔到嘢噶咯。咁啊眼盲咧就永遠翻唔翻轉頭噶啦。咁你一定要揾醫生去繼續睇啦。Now, another real issue is you're gonna have kidney problem, and kidney are a common problem. 1 out of 4 diabetic persons have some kind of kidney disease. And a doctor, every 6 months or so, they will check your GFR, glomerular filtration rate. Now, this is mean the kidney, that will be all these vessels. How they, basically, you see the kidney over here, the doctor holding the kidney, how they see your filtration. And your filtration, normal person should be 90 milligrams per millimole. If you're less than 60, you better gotta start seeing a doctor already, a kidney doctor, which is called nephrologist. If you're over 45 or younger, lower than 45, you actually have moderate kidney disease. If you go down to 15, 29, most likely when you get down to 20, you might need to have CAPD, continuous peritoneal dialysis. If you're less than 50, you have a kidney failure, you need dialysis. So all that will be very, very bad. So make sure you check this number. You do not want to go under 60. You should be somewhere between 90 to 80 or 70. If you are 60 or 70 years old, most likely you will slightly deteriorate, maybe 70, but not under 60, okay? So that is important. Now, another thing you have to test is the albumin test for protein. One time per year, your albumin should be you should be about 30 milligrams per gram. Mean that if you lower, you should have let's put it, you should not more than 30 milligram per gram. You should not have more than 30 milligrams per gram, because if you do that, that's when you're dumping a lot of protein out. That's when you really are not filtering. You're going to have kidney disease. Now, also when you have people have high blood pressure, your heart disease, and your family of kidney disease, then you would definitely have to check more. Okay. 嗱，各位堂友，腎病係好重要啊！香港咧75%嘅洗腎上人全部係糖尿病病者嚟嘅。咁佢 check 每樣嘢就呢個係會用一個血液有個 GFR。就呢個腎嘅小胞過濾，睇下你係咪有即係過濾到呢啲尿係咪過濾到喺個 kidney 度咧？過濾唔到咧，嗱普通人咧就90個 milligram per millimole 嘅，但係如果你高過即係低過去到60咧，咁你就應該要開始睇腎科醫生啦。如果你哋45咧至59咧 ，that's mean 你已經開始有一個重要點嘅腎嘅問題啦。如果你15至29咧，其實你可能要開做嘅 CAPD 嘅啦，即係呢個洗肚水嘅啦。如果跟住15咧，咁你就已經係即係直情個腎 work 嘅啦。咁所以變咗係好重要嘅。咁仲有咧，你要睇個有冇掉啲蛋白出嚟啦。喺個蛋白掉咗出嚟咧，咁你就真係好弊家伙啦。即係如果你有30個 milligram 高過咧，即係話你 kidney 都係有好嘅問題。咁同埋咧，如果你有血壓高啊、心臟病啊，同埋你有屋企人咧係有腎嘅問題咧，呢個咧又好注重嘅，因為呢個多數啲人都有呢個問題出現啦。咁仲有啦，呢個仲更加等於。The more important is there is a thing called diabetic ketoacidosis. This is a test because what happened is when you don't have enough sugar, meaning you have a lot of sugar in the bloodstream, but it doesn't go into the cell. So the cell can say, I don't have enough sugar. So they will tell the body, say, make me some more sugar. So more and more sugar will come out. And where the sugar come from? They come from liver and muscle. And when they come out with muscle, your blood sugar will become very high. And then you're going to have a lot of ketosis come out from the muscle converted sugar. And you have a lot of signs that come out. One, you have a fruity breath smell is the most common. And you do a lot of urination a lot, you will feel sick. You will got nausea, vomiting, your stomach pain, you feel weakness, your shortness of breath, and fatigue. And you also can be confused. Now with this, you have to go where? Hospital. If you have that problem, go hospital and have to do it right away to bring your blood sugar down. Usually people have 240 and above, or 14 and above, and go to 227 or so, they will have that, or they were 20 above millimole per liter. They are dangerous. They have to go to hospital. So you have to go emergency, get your sugar come down. A lot of people will get right away, get some insulin to help them go down. And that's usually the case. So this is something is detrimental for you. You need to look at this sign. 嗱，各位堂友，好重要咧。如果你糖尿病咧係轉咗酸性之後咧，呢個叫做 DKA（Diabetic Ketoacidosis）。因為個問題咧，你個血糖係好高。同埋咧，你個血糖帶唔到去 cells 度啊，細胞裏邊啊，咁細胞話我唔夠糖喎，咁但係咧個唔夠糖佢喺邊度攞翻嚟啊？喺啲 muscle 度攞翻嚟。當你 muscle 攞翻嚟嘅時候咧，咁你個糖啊繼續高啦，但係你就做咗一個情況之後咧，就有個 DKA 嘅問題發生。咁你尿道咧亦都會走呢嘢出嚟嘅。咁好多時咧，屋企你可以 check 呢個尿嘅 test。咁但係你嘅多數嘅情況咧，你個第一你個口腔咧又會有好 fruity taste 嘅，即係個果味嘅東西出嚟，同埋你成日去廁所啦，你要好好作嘔啦，想嘔啦，個 stomach 胃痛啦，又好攰啦，同埋咧會即係唞氣都有困難，可能會好 confuse 即係會有好模糊嘅人。咁邊咧呢個時間咧一定要去 emergency， 要好快脆咧將你血糖降低。This is a serious thing。呢個如果去唔到咧，會死人㗎，記住啊，記住。Another thing a lot of people don't realize, actually, when high blood sugar is also can affect the thyroid. Thyroid usually relate to hypothyroidism, not enough thyroxine, so hypothyroidism. So also the thyroid doesn't enough hormone control the metabolism. So in other words, you're not making sugar, use the sugar to make your body work. Especially women over 40, they tend to have this disease. So that also have to check. Usually they check T3 and T4 on the test. T3 and T4. So that is something they will check. 嗱，好多時咧都有人了解咧，原來咧好多糖友咧都會有呢個叫做低甲狀腺嘅情況出現嘅。咁佢冇一即係甲狀腺嘅荷爾蒙出現咧，咁佢唔可以將啲糖咧用啊，或者身體喐啊，咁佢咧就變咗越整咧糖越整高啦，咁個甲狀腺咧就變咗即係個用作咧就一路降低嘅。咁所以變咗咧好多時40歲嘅朋友咧係多數有呢個問題 ，OK。Another thing is because you affect all your nerves. So a lot of people will have gastrointestinal system problem. And so net result, they eat, they don't feel good, they feel undigested, they even have vomiting because all these are nerve issue affected because you're diabetic on the stomach. So a lot of times the doctor will do upper GI endoscopy, gastric emptying, breath test. They will do testing to find out, is it really what happened to you of a digestion system because just the nerve affect the stomach. So these are some of the tests that they would do. 仲有腸胃咧，如果你糖尿病好差咧，亦都有問題。因為點解咧？糖尿病係 affect 咗你啲成個胃、成個呢個食道裏邊嘅神經系統啊。咁所以變咗嚟講咧，當你做呢樣嘅時候，好多時咧，你成日胃痛啦，或者好似唔飽啦，或者大便唔到啦，哇！好多呢咁嘅問題發生嘅。咁嗰陣時咧，醫生就要 check 你係咪有呢個問題啦，咁就會去同你做呢個外窺鏡，睇你有冇問題啊，胃呼吸測驗啊，好多不同嘅 check 咧，就睇下你係咪呢個問題嘅。嗱 ，the last but not least, you have to check your gum because a lot of diabetes problem has a gum issue because your gum has a lot of saliva, a lot of sugar, it creates a lot of swelling of the tendon of gum, there are gum disease coming in. And the dentist will check you twice a year to clean, and there are more chances of a gum infection. So you gotta check, okay? So net result, the tooth and gum examination is very common for diabetes. So you gotta check. 嗱，仲有牙齒同牙齒嘅檢驗好重要嘅，因為好多大糖尿病者咧，佢個口腔係好乾，但係好多糖，咁咧就同埋啲口水加埋晒咧，就form咗好多微菌嘅發炎啦，咁變咗佢哋咧就多數有好多人咧就變咗 佢個牙肉啊，有牙床嘅發炎啊，同埋有呢個牙周病啊，呢個係好常見嘅。咁所以每2年咧，你應該真係要睇一次個牙醫生，檢下你係咪有呢個嘅問題。OK， 咁所以咧，呢個係即係 part of 你呢啲繼續去管理自己嘅東西啦。So in summary, basically, type 2 diabetic really need to watch for complication. It might cause you for eye, feet, your kidney, your heart, your memory, and other part of the body. So all those things can be affected to you because you have diabetes. So in order for you to check, are you really serious diabetic? You got to check your blood because that's the only way you can tell. Other thing you cannot tell. So check your blood at least 4 times a day. If you have one of these little things, you can check 14 times a day. And I check 14 times or 16 times a day. I'm 5.8 now. My blood sugar keeps dropping. It's very good, right? So it's really good. And I took no medication. I just drink LOWSUTEA and it helped me to lower my blood sugar all the time. Isn't that wonderful? And then A1C, you have to monitor A1C to check where you're at because every A1C gives you a 3 months average. And suddenly you have to drink LOWSUTEA to lower your blood sugar. And you have to check your blood pressure because your blood pressure go up, again, you stroke. You have to check your cholesterol. You have cholesterol high, you take medication. Plus the cholesterol mix up your blood, make your blood become very thick. You have major problem. You have to examine your foot every day to make sure that don't blister. And you also have the eye examination, make sure the eye doesn't have damage or retina and all that. So you have to check the eye, and that understand mainly from the doctors come from you. You have to check a kidney disease, you have get a GFR, your glomerulonephritis, glomerular filtration number, make sure it is low enough, under 7, not under 60, so you are not considered you are really need to see a nephrologist. So you have to do that. And diabetic ketoacidosis is a problem, very dangerous for you. It's a urine test you can check and make sure that you don't get that, because you get that and you don't feel well, you gotta go emergency, not to try to figure it out. You gotta lower your blood sugar, must lower your blood sugar from high, go back to like 140 or at least 6 or 7 around there. Thyroid could be an issue because you don't have enough thyroxine, you have a real issue. Gastrointestinal system can be an issue because it affects your nerve. So all those will come in. And then last but not least, you have to check your gum, tooth, because your sugary saliva can cause bacterial growth, and that can continue to damage your teeth, and your gum can be a real big issue, and can be not healing because your blood sugar is so high, circulation bad, and you have all sort of problems come along. So when you're diabetic, these are the things that you have to continue to check, make sure you're not fall into the big problem that you can put opportunity to go hit together, hit your system to be a really serious diabetic. So today, that is the summary of what we do to give you more alert, the things that you'll watch for. So I hope that will be good to have you better understand. 嗱，各位同友，記住，當你糖尿病大患者嘅時候咧，好多時咧，你會影響你嘅心啊、臟啊、眼啊、同埋其他不同嘅身體嘅地方，因為所有地方都係 block 咗嘅。咁呢個係好重要啊，所以你咧每日只係能夠 check 咧，就係點 check？一定要度糖，你唔度糖咧係 check 唔到嘅，度糖度4次。一起身度1次，然後每次食2個鐘頭之後食飯又度1次。咁你要 check A1C 係幾多？因為 A1C 俾你3個月度糖啊，咁好重要啊。咁你一定要入去糖場啊，幫助你降低血糖。如果你冇呢個Ability 咧，其實我哋公司都有賣，或者你喺第二度都有賣嘅。咁你可以度呢一個咧，就可以每日度14次，唔痛嘅喎。依家5.8，咁幾好啊！我唔痛，我度10幾廿次冇問題。OK， 咁同埋咧要 check 你自己嘅血壓啦、膽固醇啦，同埋你腳有冇blister 啊嗰啲東西啦。仲有咧，你就要 check 你隻眼啦，醫生要 check 你眼，因為如果你眼個開始壞咧，你係翻唔到轉頭嘅。咁你要知道咧，仲有你嘅腎係咪有問題咧？如果你 under 60，咁你就真係要睇腎科醫生喎。咁同埋仲有一個重要咧，就係如果你有 DKA 咧，即係話你係有呢個 diabetic ketoacidosis 咧，咁呢個係好大問題嘅，呢個要入醫院嘅，即刻入醫院，因為你可以個血液可以中毒啊，太高啦。咁嘅時候咧，你就要快去睇醫生啦 ，OK？ 咁之後咧，thyroid 咧，亦都甲狀腺啦。如果甲狀腺有問題咧，亦都要有呢個問題出現啦。咁呢個就亦都要去控制睇下係咪有 T3 T4， 你唔夠 T3 咧，你就食藥，或者俾多啲甲狀腺荷蒙俾你。咁同埋咧，因為你個肚咧係有問題啊，因為你個 nerve 整到肚壞咗啦。咁所以變咗嚟講咧，好多時咧你就有好多肚嘅問題啊，譬如大便有唔暢順啊、肚痛啊呢啲咁嘅嘢啦。咁亦都牙齒方面咧你要注重啦，因為如果牙周病咧，亦都係一個好大問題嘅。嗱，咁我依家 answer Eugene啲問題啦。咁同埋咧 ，How do you mean decrease vision？OK，what do you mean decrease？其實如果你what do you mean decrease vision is when your eye become really let me show you this. When your eyes have all sort of blood vessels coming out all over the place, blood clot here and cholesterol over here, it will damage your nerves. So your eye become decreased vision, become more blur. So that's mean decreased vision. 嗱，因為當你個眼嘅時候咧，好多啲咁嘅黃點啊、cholesterol 啊，啲眼係咁啲血管係咁生出嚟咧，咁開始咧就會影響你個成個眼嘅 retina， 你個眼膜。同埋咧，你睇嘢會開朦，咁啊 decreased vision 就係朦，咁啊睇唔到啦。OK， how often should I take my BP？ Now your blood pressure should take at least once a day. Once a day, your blood pressure should take once a day. 嗱，每日咧就應該最低係睇一次，你開始起身嘅時候，你血壓係點樣，或者你係食晚飯未瞓覺之前，亦都係做一次。So usually, what you should do is take once a day in the morning. It's good to even do it once an evening before you go to sleep, or in the evening, so you can at least have a baseline all the time, understand the pressure. Okay, so good. I appreciate all the time you guys have spent with us, and thank you very much for all the questioning. I hope to continue to see you guys, continue to work with you, holding your hand throughout your life. Work together to lower blood sugar. Same for me. I'm also want to lower my blood sugar, so I want to be healthy. So again, thank you for all the time you guys work together with me throughout a busy weekend. Listen to help each other on motivate each other, kind of speak, to continue to lower our blood sugar. That would be wonderful. Another question from Gordon is that what is the cost of tingling the feet? When your blood sugar high, it damage your your foot nerve. Actually, not only a foot nerve, the whole body nerve actually, but foot nerve will continue to damage. So your nerve will damage. They will start getting tingling in the feet, and you're gonna get numb. That's what it costs, the nerve damage. So Gordon, thank you very much for your question. This is important because even pre-diabetic will start getting the feeling of dryness. Eventually it will start feeling tingling. Even pre-diabetic will start off that. So that is kind of scary, isn't it? A lot of people don't know. I just feel itchy, but you get pre-diabetic, that will be happen. So remember, tingling in the feet is important indicator of you getting worse, your nerve damage. Okay? 嗱，各位，佢Gordon問咗個 question 咧，就係如果你係隻腳咧開始有啲感覺好似 tingling 啊，即係numbness 啊，或者好似刺刀咁嘅感覺咧，個原因就係你開始有 nerve damage。當你有呢個情況發生嘅時候咧，咁呢個咧係 nerve damage 嘅開始啦。咁就算咧前期患病者人咧都有呢個發生，所以好小心。記住唔好即係呢個所謂叫唔注意呢個東西啊。OK， 呢個就係開始有nerve damage. Okay, so again, thank you for a wonderful question. You guys are always good to ask good questions. I'm very happy to have you guys ask those questions. So I will see you next week. Continue to hold your hand throughout our diabetic journey. Take care. Bye bye.